esteemed colleagues, distinguished guests, and dear friends. A very happy new year to all and a warm welcome to this celebration. Today's gathering is a testament to our shared commitment for advancing knowledge, fostering professional knowledge, and joy of togetherness, balance between science and intellect, and emotion and happiness which bind us all together. On this special occasion, we have a distinct honor to have with us Dr. Abha Majumdar. She is a stalwart in the field of infertility and reproductive medicine and the director and head of the IVF and Human Reproduction Center at Gangaram Hospital. Dr. Majumdar's invaluable contributions have transformed the lives of countless families, and her work has truly paved the way for advancements in India. Along with her presence, we have the privilege of hearing Dr. Abha Majumdar deliver a Silver Jubilee oration. A Silver Jubilee oration is not just an event. It is a testament of perseverance, a beacon of inspiration, and a pledge to strive for greater heights in the coming years. The topic of infertility, it is not timely, but also deeply relevant, as it chronicles the evaluation of field that has brought hope and joy to millions. Dr. Majumdar's insights, drawn from her vast experience and groundbreaking work, will undoubtedly enrich our understanding and inspire us all. As we begin this year together, may this oration serve as a source of knowledge, motivation, and unity for all of us. Together, let us celebrate not only dawn of new year, but also the spirit of collaboration, knowledge, and joy. With that, I invite you all to join me in welcoming Dr. Abha Majumdar to take the stage. And along with this, I will just read a small CV of Dr. Abha. Dr. Abha is an emeritus consultant, director and course director for Fellowship of Reproductive Medicine by the NB. Abhi kar do. She is in charge of Infertility and Human Reproduction, Sir Gangaram Hospital, New Delhi. She had 7 gold medals, President's Silver Medal, and Chancellor's Medals as medical graduate from 1970 to 74 from Agra Medical College. Her team was responsible for birth of the first IVF baby in North India in September 1991, and I am fortunate enough to have that baby in my neighborhood. Abdul Kalam Gold Medal Award was received by her in 2015. Rashtriya Gaurav Medal Award in 2017, and Bharat Ratna Rajiv Gandhi Gold Medal Award by Global Economic Progress and Research Association. She is a Distinguished Teacher of Excellence Award for PG Medical Education by National Board of Education 2017. She is IVF Champion of Year 2019, and the team has the best integrated national team of IVF by Economic Times and again awarded twice as IVF National Champion in 2022 and 23 by Economic Times of India. She has got many lifetime achievement awards, and to name some are by Obs and Gynae Society of Hippocrates Foundation 2014, by Indian Fertility Society in 2021 and Gynae Society in 2022. She is member of editorial board of IVF Worldwide, peer reviewer of Journal of Human Reproductive Sciences, and member of board of Journal of Fertility Science and Research. I welcome again Dr. Abha Majumdar.
For giving me this honor today. I am truly overwhelmed. Truly overwhelmed, ma'am, for this honor. I'm very happy that you gave me a topic which is very close to my heart. When I look at this forum, I feel that we don't need a lecture, we don't need an oration. What I'm going to tell you today is a story. It is a story which will uncover so many truths and myths and maybe give us food of thought for future well-being of the system, well-being of IVF and everything. I have read a lot of history of IVF, especially Adit Bharadwaj is one name which comes to my mind, who's written volumes on the history of IVF. And I'll tell you about 45 years of journey of IVF. It is 45 years of journey of IVF for the world and also for India. So when did it start for the world? It started with the birth of the super babe, Louis Brown. This child, a baby girl, was born in UK on the 28th of July. This was the first creation of the world for a test tube baby. How many years of work went through, Dr. Bakshi was telling us, so many miscarriages happened, so many conceptions failed to happen. There's a very beautiful movie which has just been released by the name of Joy. Please see that and you will know that apart from the two persons who brought this baby into life, that is Edward Steptoe and Robert G. Edwards. These two, Steptoe was a gynecologist, Robert G. Edward was the scientist or physicist. These two brought the baby, but there was Jean Purday, another person who was very deeply involved, and before this movie was released, her name is also included in the plaque where they have written the two scientists' name in the Cambridge University who were the creators of the first IVF baby. And you'll be surprised that Robert G. Edwards, the physicist behind this, well, the gynecologist didn't get anything, no award. In any case, Steptoe was not even alive when this award was given in 2010, which is 32 years after the creation of Louis Brown. He was awarded the Nobel Prize. So that is the history for this first child which happened. Louis Brown's birth changed the face of reproductive medicine. Totally, it was a landmark research where a baby was conceived outside a woman's uterus, outside the body. Having said that, I'm going to tell you an amazing story of 45 years of IVF where more than 8 million babies are born. Which was the first out of these 8 million babies? Well, this old bell jar still sits on the top of the cupboard at Cambridgeshire Fertility Clinic, which made history 45 years ago. In a dish inside this jar, the world's first IVF baby spent few hours before it was implanted in the uterus of the mother. So Edward and Steptoe were responsible for Louis Brown's birth, 1978, 25th July in the UK. Then came in another UK baby after 6 months, Alastair, who was the first baby boy, born in 1979 January, again same team, Edward and Steptoe. They had started the ball rolling for the whole world. Then came in Australia's first baby, Candice Reed, in 1980, almost a year after UK's second baby, by the efforts of Johnston and Lupata. Then came in USA's first baby, again after about a year, by the efforts of Howard Jones and G.S. Jones. And then came in many more babies. And then it was turn for the first officially documented Indian baby to come up by the efforts of T.C. Anand Kumar and Indira Hindujaji. This baby was named as Harsha and was born on the 6th of August 1986, which means 8 years after the world's first documented IVF baby. But do you find a defect in this staircase? Isn't a step missing somewhere? This was the birth of India's first IVF baby, which went non-documented. This was Kanupriya. The real name is Kanupriya Agarwal, but Durga was her given name, born in 1978 when Louis Brown was born. just 66 days after the birth of the first baby. And do you know this was cryopreserved for more than 50 days? So she would have been born much earlier if the embryo was not cryopreserved. And this was by the efforts of Subhash Mukhopadhyay, S. Mukherjee, who was the cryobiologist. I had an opportunity to meet him this year. 2 years ago, I was invited to Calcutta Gynae Society to give an oration on Subhash Mukhopadhyay only. And I met the cryobiologist, who's quite old. I think he was 89 2 years ago. And he was the one who cryopreserved that embryo. And S.K. Bhattacharya is Saroj Bhattacharya, the gynecologist, who delivered this baby. So why did this happen, and who is this Subhash Mukhopadhyay? We all need to know, because he's Indian. And we see that this step was missing in the whole world's history till India's first documented baby was born. He was a double PhD holder. He was a reproductive physiologist and a reproductive endocrinologist. He was a professor of physiology in Neil Ratan College, Calcutta Medical College. He had worked once upon a time in England in the Royal Infirmary of Edinburgh in 1967. And then he was exposed to the work of Steptoe and Edward Richard. And I've already told you, Suneet Mukherjee was his cryobiologist and Saroj K. Bhattacharya was the gynecologist. Let us see what he did. Well, he had handwritten notes, the problem which we all have today. We do so many things, we see so many exceptional cases, but we only have handwritten notes. We do not publish it anywhere. We do not let anyone know what we are doing. And this was the problem with Subhash Mukhopadhyay, that his work did not get recognized. His notes show a successful cryopreservation of an 8-cell embryo, whereas the first baby was born out of a 4-cell embryo. Then 53 days it was cryopreserved and then replaced into the mother's womb in a natural cycle, natural ovulatory cycle, resulting in a successful live birth as early as in 1978, which was 5 years before the world's first cryopreserved baby was born by the efforts of Linda Moher and Alan Trounson in 1984 from Australia. So look at the first which we had with this man. Some of his remarkable achievements are HMG for ovarian stimulation for IVF was used way back in 1978. Do you know that HMG was started to be used before clomiphene citrate came into use? He was the first to use transvaginal approach for ovum pickup. In the 1970s, when I was in the medical college, we used to do so much of transvaginal ligations. So we were experts in, sort of delivering the tube and ovary out, stimulating it, and then he aspirated all the oocytes from there. Not the laparoscopic aspiration as was done in the first IVF baby by Steptoe. He was the first to cryopreserve human embryo. He was the first to transfer embryo in a subsequent untreated cycle. Now, what do we call this man? His notes in 1978 clearly showed that he was in the right line of thinking much before anyone else had demonstrated the successful outcome of a pregnancy following the transfer of a frozen thawed embryo into human subjects, which is now the call of the day. We do all our transfers as frozen transfers only. So this man should be called a creator, an architect, or the father of IVF. I mean, we are at loss of words to respect and to acknowledge the work of this great human scientist who created life in a way which no one else, not even the first IVF baby, was created. But then, he was the first to perform IVF in India, but instead of being recognized, he was called a liar. By whom? By the Bengal Doctor Society, the IMA of Bengal Doctor Society, by the bureaucrats, by the administrative people. They all, instead of recognizing his work, they insulted him. They barred him from attending conferences and sharing his achievements. They told him, you are a liar. You are making up stories. Such a thing cannot happen sitting in a small room with an ordinary refrigerator. So he died on June 19th, 1981, which is just about 2.5 years after all this great discovery of his. Why did he? What happened to him? How did he die so young? He committed suicide at his Kolkata residence. And who came to his rescue? Have you seen this movie, Ek Doctor Ki Maut? Which starred Shabana Azmi and the gentleman whom you see on this photograph, I don't know his name. But it is always Bollywood who comes to our rescue, whether it is Talwars or it is Jessica, No One Killed Jessica, or it was Ek Doctor Ki Maut. So it was Bollywood who showed his story, because they could understand the reality of what happens to a common man if he is not acknowledged by the hierarchy. And who else? How was he recognized? Well, T.C. Anand Kumar was a scientist. He was the director of Institute for Research and Reproduction. He acknowledged his achievements. Now, who is this T.C. Anand Kumar? And his recognition, like the Nobel Prize, came after 32 years of the making of Louis Brown. His recognition came 22 years after his baby was born, baby Durga. And who was Professor T.C. Anand Kumar? We all wonder that who was he and why did he have the right to do this? Well, he was the creator of the first officially documented IVF baby of India, Harsha. And imagine, 11 years later, T.C. Anand Kumar, the pioneering doctor who collaborated with gynecologist Indira Hinduja to create India's first test tube baby, realized that the title he bore belonged to someone else. I mean, what greatness must this man have to give away his title like this? Meticulous scrutiny done by him and cross-verification made Anand Kumar conclude that the Bengali doctor had preceded him by 8 years. India's first test tube baby, Kanupriya Agarwal Durga, had already been born on 3rd of October 1978 in Kolkata. Durga was also the world's second test tube baby, born just 67 days after the headline-grabbing birth of Louis Brown in UK. So, we have to give tribute to this man. He's another unsung hero. We all know Dr. Indira Hinduja's name, but nobody even thinks of T.C. Anand Kumar. His counterpart got a Nobel Prize in the UK, and people don't know his name associated with the first documented IVF baby of our country, because such generosity and honesty are very rare. Professor T.C. Anand Kumar had the courage to research his predecessor's findings and scientifically presented to the world, giving Dr. Subhash Mukherjee his due place in the medical history in 2002. ICMR recognized his work and said that yes, that was India's first test tube baby. And this was through an article in the journal Current Science entitled Architect of India's First Test Tube Baby, Dr. Subhash Mukherjee. This was his article. You must take it out and read it. It is so beautiful. Thanks to this article and Anand Kumar's tireless efforts, the Indian scientific world belatedly woke up to the monumental nature of this medical achievement in such ordinary circumstances which we had in our country, where no big laboratories were there, no big equipment was there, where this first baby was created. Having said that, Professor T.C. Anand Kumar passed away in 2010, 26th January. And he ended his illustrious career then only, a man who stood for truth and had the greatness to give away his fame and glory of being the pioneer of India's first test tube baby when he discovered all the handwritten notes of Dr. Subhash Mukhopadhyay. Well, IVF was born in the world. In the West, it was with the birth of Louis Brown in 1978, and in the East, it was by the birth of Kanupriya Elias Durga in India. So now let us come to real facts about IVF, what happened. IVF was started for medical reasons. If you see this movie Joy, you will find that this girl, Jean Pedre, had severe endometriosis and she wanted to have a child. She couldn't have a child and she was the assistant for both these doctors. Well, so IVF started for tubal factor infertility and severe endometriosis. Then we came into unexplained infertility, and then male factor infertility was added to it when we started learning the art of ICSI also. So male factor infertility, then testicular sperms, and we could also do ICSI with those. Use of IVF started to expand because of many reasons. One was awareness was increasing, knowledge, availability, and acceptance of people for IVF. True rise in the incidence of infertility, and we all know partly it is true rise and partly it is exposing your infertility status to everyone, that yes, I am infertile and I need treatment, I've been trying to conceive, rather than hiding and saying, no, I don't want a child, I've not tried. And advancement of technology. What was the advancement then? Well, after IVF, the first advancement which came in was ICSI, intracytoplasmic sperm injection. Then started coming in all the third-party reproductions like oocyte donation, embryo donation, surrogacy. Then came in another thing, oocyte and embryo freezing. 5 years later, which was done by Subhash Mukhopadhyay right in 1978. And then came in pre-implantation genetic testing. So we had covered almost a lot of problems which we wanted to sort out were all covered. So all these technological advancements were done to widen the application of IVF. Like ICSI started for couples with male factor infertility, where IVF could not lead to fertilization of the oocyte. Oocyte freezing was done mainly for fertility preservation before cancer therapy. PGD and PGS was done to eliminate a disease from the embryo or select a euploid embryo. And then third-party reproduction came in. This is where all the problems started. Oocyte donation, it was for women with ovarian failure and insufficiency. Embryo donation, couples who had deficiency of both sperm and egg. And surrogacy, couples where women had no uterus or a non-correctable defect in uterus. But we always have a right way and a wrong way of going ahead. And sometimes it is easier to pick up the wrong way because the pathway is very short. And hence, what happened about all this technological advancement? There was improper use of technological advancements. ICSI started to be as a poster for advertisement where you would say, I will do ICSI, I will charge so much more, and I will do it for all, so that you don't have a chance of fertilization failure. So it was being sold like that. Oocyte freezing, it was for cancer patients, but then it became for career options, social freezing. PGT for sex selection of embryos. And then comes all the donor things, donated oocytes, all women who were having IVF in a place which was substandard, one cycle failure, they used to immediately go to oocyte donation. Why? Because these girls were young, less than 30 years old, they were fertile. So it was much easier to obtain better embryos by eggs of girls who were fertile and who were much younger. Embryo donation, it started for couples of any age and every age. Older the better, because it was always a feather in the cap of the IVF specialist to say that, you know, I have had a 60-year-old or a 70-year-old as mother. And surrogacy started happening for couples with family but financially powerful to afford a larger family and not jeopardize one's own health with motherhood. It also started for single men, gay couples, everyone. And probably this was the time when the government started looking into surrogacy and thought, oh, IVF is surrogacy. No, surrogacy is a very, very small part of IVF. But then the whole bombshell fell on the IVF when they said surrogacy is being used unjustifiably. It is being used for couples who have children, for people who have money, and it should not be used. So they just stopped surrogacy for all. However, they've been very kind to at least start surrogacy on altruistic grounds with people closely known to you. So anyways, we'll come to that. So in the past, IVF was the last resort. We all thought that we'll keep it confidential. I still remember when we had our 10-year function, 20-year function of IVF, the couples would say, we will not come because people will know that we had a baby through IVF. Or when the lady used to come for, some of my patients went away elsewhere to deliver because they said, if we deliver with you, they will think that this baby is conceived through IVF. So it was so much taboo, it was confidential, but now the scene has totally changed. Now it is this. It is the first resort. Couple walks into the IVF clinic hand in hand with money in their pockets, and they say that we want a baby ASAP. With expansion of IVF came problems also. We all have to understand affordability, financial issues are there, especially with failures, complications and health concerns. I mean, if I go into a list, it will take a whole lecture on its own. Emotional drain with denial of failure. When we enter IVF, we all feel that the patient thinks that, I've come to a good center, the doctor is saying a good embryo, good egg, good sperm, I will 100% get pregnant. But 100% is only in the hand of that Lord, not in our hand. So there's a lot of emotional drain and a denial to failure. But last and most important, which we need to correct, is misuse of technology for social reasons, especially the third party IVF. So when it is your own gametes, your own uterus, corruption is not likely happening there. It is only happening when we add another person to the whole IVF. The worst happened with commercial surrogacy. India became surrogacy capital of the world because we don't have dearth of poor women who may give their lives for their family, for their children, for their husbands. So for them, carrying a baby for 9 months is no big deal. They would carry a baby, deliver happily for someone else if they got something in turn to make their children's lives better or their families' lives better. But then it was a multi-million-dollar business in India, with majority of money spent going to agencies, lawyers and brokers, not to the woman who was carrying and birthing the child so desperately wanted by a couple and risking her life to it. Then this gamete situation changed the whole thing in Thailand. They stopped surrogacy. Twins were born, one baby was Downs, the other was normal. The Australian couple just took the normal baby and left the Downs baby to be in an orphanage. So, these things went on and on happening all over the world, where the recipient couple would come from abroad and abandon a child which was not normal, malformed, or mentally abnormal. And history is witness to the fact that once a middleman is created, in surrogacy, what was it? It was a middleman who brought these women to IVF centers and said, okay, we'll have surrogacy. It gives birth to only one thing when a middleman is created, and that is corruption. The corruption started to rise and rise and rise, so much so that the government became aware of it. And I'm very thankful that Sushma Swaraj ji came into it and said, we have to stop this surrogacy. Why? Look at these couples. Elton John, the singer for Lion King. They are gay couples and they have children through surrogacy. Look at our superhero, Shah Rukh Khan. He already had a boy and a girl, yet they went for a surrogate and had another child. Oh, when his wife was older, they could have just got a donor egg and his wife could have produced the child. Anyways, all this drew a lot. I've just given very few examples. You all must be knowing at least thousands of examples of the celebrities, especially Bollywood, having. And embryo donation, let's talk about it. These were the ad punchlines. Donate your embryos. Are you uncertain of what to do of your frozen embryos? Do you want to kill those children? Don't kill them, donate them. Give hope through embryo donation. And it also said you can give birth to your adopted child. These embryos are like as if you've adopted your child in your uterus and you've given birth to that adopted child. And the punchline was, donating parents are greater than adopting parents. So a lot of mental sort of psyche was used to say that donate your embryos, don't destroy. We've seen couples coming to us, doctor couples, and saying, please destroy our embryos because we've completed our family and we don't want to pay for further cryopreservation, and we take it out and put it in the dustbin in front of them. I don't think it harms much at this stage if we destroy them. But if we don't tell them and quietly give their embryos to someone else and maybe also have monetary gains, that is really criminal. And we don't know whether this is boon or bane for the baby whose fate we are going to decide, the person whom we've given your little babies, in your children, with your genetic makeup, which would have grown up in your house, are growing up in someone's house whom you would never want your child to grow up. If you had a child and you had to give your child for 6 months to be kept in that house that look after my child, you wouldn't have done it. And your child has grown for life in that house. So we are deciding the fate of these children. Look at these pictures, these mothers. This mother with triplet, she died after 4 months, and all these children went to the orphanage. This is the mother on the other right-hand side. This is what, Rajo Devi. The other one is Bateri Devi. Then in Australia also, 56 was the age where a mother had a child. And the oldest is the 74-year-old. You all must have seen this picture. They are so much like grandparents or maybe great-grandparents also. They are the ones who looked after this child. I mean, look at the child's future being brought up by a person 2 generations behind them or 3 generations behind. We never knew where to draw a line. We never knew how old is too old. And I remember fighting for it. And much before the ART guidelines came up, maybe 15 years earlier than that, we drew a line at our center that 50 should be the cutoff. And very happily later on, we saw that 50 was the cutoff through the ART rules. So I'm talking about the unborn speechless baby who has given us the right to write the destiny of these babies who are stored in our cryo cans. Is this factory for orphan production, or are we playing God? That we give these babies to 70-year-old women, 60-year-old women, and they become orphans sooner or later. Or it is another feather in our cap that we feel, oh, we can advertise that we've given birth to a 70-year-old mother, we've given babies. So we don't know really what is right or what is wrong. So again, there is a right way and the wrong way. This time, our legislation came to save us. And it told us the right way. It made laws. We Indians need laws to be regulated for everything. I also think for even sort of cleanliness, we need laws. If we are fined, we will not litter everywhere. So in 1921, December 21st, 18 December, the ART Regulation Act was made and was passed by Lok Sabha and Rajya Sabha both in our country, which was in the making for the last 20 years by ICMR. And it was drafted and it came into force on the 25th January 2022. Now, having said that, what happened? First thing is IVF was very beautifully regulated. It is still being regulated because all the centers do not have the registration, but at least those who have the registration are lucky enough to make sure that they have proper record keeping. Number one, most important thing for if you want to do quality assurance and quality control, unless you do not have your data, your records in place, you cannot review and see what thing is giving you good results and what is not. Then standardized equipment, standardized personnel, standardized consent forms, and discharge summaries. Discharge summaries are a must, like you give for any hysterectomy or any other surgery. It is not a procedure under the table. It is very unfair not to give a proper discharge summary. How many oocytes were retrieved, how many were mature, how many were injected or kept for IVF, and was there any fertilization, how many 2PNs, how many 2PN, how many 4-cell and 8-cell, and day 5 or day 6, proper grading has to be written and given. Just not handing over pictures suffice, because they do not tell us anything. So the law is designed to ensure patient safety through accrediting clinics and setting minimum equipment standards. It provides an ethical framework for practicing ART and brings in legal clarity as well as transparency and accountability. If you get a good discharge slip, you know exactly what went wrong with this patient, whether it was fertilization or it was further, whether they reached cleavage stage embryo, whether everything was arrested in between, and you can work on that. Otherwise, you have to start from scratch for every patient. Having said that, it also limited mushrooming of centers. And it also stopped flying clinicians and embryologists, because when a person does not belong to a place, you do not connect with the patient. And I think connection to a patient is more important than just treating the patient well. The moment you connect, automatically your medicine or your application of the technique becomes better, and it results in more success. Having said that, third party, let us come. One third party is semen donors, which doesn't come under the umbrella of IVF. Well, now they have made only one-time donation allowed. In a huge country like ours of 1.4 billion, we earlier said, okay, let a man give 10 times semen and we will have no consanguinity. No, but we have to prevent. If we are limiting our family structure to 2 children a family, then we also have to limit a man's donation to lesser number, and ART has brought it to 1. Yes, the result is that semen donation has become costlier because one man can give only once, but it is very good. Oocyte donors attempt to safeguard their health, but no compensation. It is very difficult to get someone without compensation, but their insurance policy safeguards their health for 1 year. And there are disguised deals because no lunches are ever free. Then embryo donation banned. What do we do of extra embryos? Our tanks are full of embryos. And last of all, no pregnancy in women over 50 years, all win-win situation, very good to make a law where over 50, no woman can have an embryo transferred in her. Owing to regulatory restriction on donor programs, a lot of smaller clinics are facing strong headwinds, and this happened in the beginning. Now everyone has stabilized and has been able to adopt. So surrogacy, only altruistic. So what do you think has happened? Is this real, or transfer of money has changed hands? Earlier it was going to brokers and now maybe a little higher on. I would not take the names, but yes, to the legal people, to the lawyers who are earning much more than what these brokers were doing. And therefore, to conclude, I would say that scientific advancement will happen. We cannot stop because our brains are absolutely great and rife, and social exploitation will happen. Whether it is mobile phone, it is internet, or it is the television, or it is IVF. What do we need to do is a balance between the two. We as responsible clinicians, doctors, educated people of the society have to bring a balance. And with this, a lot of technological advancement has happened in the last few years, the time-lapse technology, PGT to select the best embryo. Then it is the 3-parent IVF where for an older lady, oocyte, we take the nucleus from the older lady and the cytoplasm from the younger to get rich mitochondrial cytoplasm and make a baby. All these are real. PGT, PGS is real. Then all this is still under research, so please do not attempt these things on your own, whether it is PRP injection or any other form. It has to be done under research setting with proper registration number, and menopausal reversal stores and restores periods and produces fertile eggs, ovarian rejuvenation therapy. All this is going on, and the last is CRISPR, where they are editing the chromosomes by cutting off the genes which are defective. So, advancement of technology with the application of genetics and IVF is very fast progressing, but we all need to join hands and follow the law. It is very important that we do not do procedures which are not allowed to do in a clinical setting. We can do them in a research setting. And evolution is change for good. It has to happen generation after generation, and evolution has happened the fastest in the last 30 years with the coming in of internet, mobile phones, and now the AI, and there's no end to how evolution is going to happen in the next 20 years. But we have a good and strong legislation to safeguard mothers as well as the unborn child who might get entangled in this rut of human race unknowingly and unaware of the implications. Human brain is very fertile and cannot stop at this. It will continue to find more and more applications to the technology, and on the other side, more and more misuse to the technology also. The technology must continue to grow as it is one of the greatest advancements in the field of medicine, where life is created outside human body, and hence, this is the last slide. Louis' own birth was the landmark that changed the face of reproductive medicine in the world. It was the tenacity not only of the scientists and gynecologists, but of those innumerable women who trusted on these scientists and months after months stayed in the infirmary. What did they do? We had no hormone testing. It was only urine LH surge or a pregnancy test. That was all. There was no ultrasound. There was no site retrieval. So how difficult it must have been for these women to have faith in their clinicians, stay there and have the baby. But because of their tenacity, now so many childless parents have happy families, they have children, and hence I would say the woods are lovely, dark and deep. I've changed the word a little bit, but we have promises to keep and miles to go before we sleep. Thank you very much.